Okay, ready for a deep dive.
Yeah.
Today we're tackling body dysmorphic disorder, BDD. And wow, you guys weren't kidding around with this source material. Medical journals, research papers, even some historical stuff.
Yeah, and it's a good thing too, because BDD, it's often way more misunderstood than people realize. They hear body image and they think, oh, just someone vain, but it's so much deeper than that.
Right, it's way more than just a bad hair day kind of thing.
Right.
So how do we even explain BDD as a serious mental health issue?
It's about this intense, like, preoccupation with what you see as flaws in your appearance. But here's the thing, these flaws, they're often barely noticeable, if at all, to anyone else. Sometimes they're even completely made up in the person's mind. But for someone with BDD, it's like these perceived imperfections are huge EE, like super distressing, really impacting their daily life.
And some of the research even pushes back on that whole imagined defect thing, right? It's like,
Yeah.
it's less about a specific thing being wrong and more this overall feeling of ugliness or just being off somehow.
Exactly. Some people zero in on one feature, sure. But others, it's this broader sense of ugliness, they just can't stand how they look, even if they can't pinpoint one specific thing. It's about not being comfortable in their own skin.
And it's not like a small number of people are dealing with this either. The stats you set were kind of shocking, actually.
Right. Studies suggest it's somewhere between like 0.7% and 2.4% of people, but even that's probably low. The stigma around this is intense, so people don't talk about it.
Makes you wonder how many people are out there, like, silently struggling, huh? Could be anyone.
Absolutely. And that brings up the whole demographics thing. It can be anyone, yeah, but there are some interesting patterns.
Like how it affects both men and women. But the stuff they fixate on is often totally different.
Totally. Culture plays a huge role there. Men, for example, might be way more focused on hair loss or muscle mass, while women might be thinking about their skin, breast size, or weight. But those are just tendencies. BDD can show up in so many ways.
And it's not new either. Some of those historical cases you dug up were wild.
Right. It's been around even if people didn't have a name for it back then. Like even in the late 1800s, doctors were describing people fixated on perceived flaws, calling it dysmorphophobia.
And even pop culture icons like Andy Warhol might have been dealing with this, right? His autobiography was pretty eye-opening.
For sure. That whole thing about the redness of his nose, wanting to be plain, it's like even without today's terms, you can see the struggle. Just shows BDD has always been there, even if how we understand it has evolved.
Right, which proves this isn't just some modern, vain thing. It's a real condition that causes real distress. So any idea what causes it? Nature, nurture, or?
Like most mental health stuff, it's this big mix. Genetics are in the mix, definitely. BDD tends to run in families.
So that's a part of it, but not the whole picture.
Not even close. The environment someone grows up in, especially childhood experiences. Huge factors. That research about teasing and bullying was powerful.
Yeah, that was rough to read. Seems like those experiences, especially as a teenager figuring yourself out, those can leave a mark.
Totally. Being teased about how you look, especially if it's tied to, like, a skin condition or something, that seems to make someone way more likely to develop BDD later on. And the thing is, even if the flaw goes away, the emotional impact, that can stick around.
There's also that aesthetic sensitivity thing that came up. Like, people with BDD are just more, I don't know, tuned into beauty and ugliness.
Right. It's fascinating. Research suggests that people with BDD are super sensitive to visual cues, especially when it comes to appearance. They'll notice stuff that most people wouldn't even register.
So they're hyper aware of all these tiny details. Is that sensitivity what causes BDD, or is it the other way around?
$1 million question. Researchers are still trying to figure that out. Is it something they're born with that makes them more vulnerable, or does it develop alongside BDD? Could be both.
A real chicken or the egg situation there.
Ah.
But either way, it clearly shapes how people with BDD experience the world. Speaking of which, we got to talk about the role of attention here, because the source material highlighted that big time.
Oh, yeah. This is where it gets really interesting. People with BDD often get stuck in this hypervigilance mode. They're constantly looking in the mirror, scrutinizing themselves, laser focused on those perceived flaws. It's like tunnel vision.
And because of that, they start doing all those safety-seeking behaviors we talked about, right?
Yeah.
The mirror checks, the camouflaging, the avoiding social situations, all to try and quiet those feelings.
Exactly. And yeah, it might feel better in the moment, but those behaviors just feed the cycle, making those negative thoughts even louder over time.
So it's like a trap. The more you try to fix it, the worse it gets. So how do you break free? How does treatment even begin to untangle that?
Well, luckily, there are some effective options with CBT or cognitive behavioral therapy being the gold standard for BDD.
And CBT is all about changing those thought patterns and behaviors, right? Like breaking the bad habits.
You got it. It really is. Basically, CBT helps connect the dots between what you're thinking, how you're feeling, and what you're doing because of it. So, like, you have this thought about your appearance,
Yeah.
right? And that thought, it triggers all this anxiety, shame, all those tough emotions.
Which then leads to, you guessed it, those safety behaviors we keep talking about.
Mhm.
The mirror checking, hiding behind clothes, skipping social events, all to try and outrun those awful feelings.
And sometimes it works for a minute, right? But it's a Band-Aid. Those behaviors actually make the negative thoughts stronger in the long run.
Like a snake eating its own tail.
Yeah.
The more you struggle, the more trapped you get. Okay, so if that's the cycle, how do you actually break it? What does treatment look like?
So there are a few approaches, but CBT, cognitive behavioral therapy, that's like the gold standard for BDD.
And CBT focuses on tackling those thoughts head on and building new, more helpful behaviors, right?
Exactly. One of the big ones is called cognitive restructuring. It's about identifying those distorted thoughts and challenging them, like helping the person see things in a more balanced, realistic way.
So instead of my nose is hideous, it's more like my nose is a normal size, and even if it wasn't, that doesn't make me any less worthy as a person.
You got it. Detaching self-worth from those perceived flaws. Now, another biggie, exposure therapy.
That's where you gradually face your fears, right?
Exactly. So with BDD, that might mean slowly cutting back on those safety behaviors. Less mirror checking, easing up on the camouflage, maybe even going to those social events they've been avoiding.
Sounds terrifying if you're the one going through it.
It can be tough, no doubt,
Yeah.
but it's all about gradual steps, always with a therapist's support. The idea is if you face those fears head on, over and over, without resorting to the safety behaviors, that anxiety, it eventually starts to fade.
Like you're staring down the monster until it blinks.
Exactly. And research shows exposure therapy, really effective for BDD. People start taking back their lives, feeling less controlled by those intrusive thoughts and urges.
We also talked about habit reversal, especially for things like skin picking. The research there was surprisingly positive.
It's been a game changer, really,
Mhm.
especially for those repetitive behaviors, skin picking, hair pulling. It's about awareness first, recognizing when you're doing it, what triggers it, but then the important part is having something else to do instead.
So, like, instead of picking, you might squeeze a stress ball or something, or do some deep breathing.
Exactly. Giving them healthier tools to manage that anxiety so they can break the cycle.
It's amazing how many different tools are out there now. So much hope for people.
There is. And while medication's not always the first line of treatment, it can be really helpful for some people alongside therapy.
We'd be remiss if we didn't talk about cosmetic procedures too, because that's a whole other can of worms with BDD.
It is, and it's something we got to handle carefully. I mean, if you're struggling with BDD, cosmetic surgery can feel like the answer, right? And this is a big BUT. Research is showing it's usually not that simple.
Right, it's not a magic fix. In fact, the sources you shared made it clear that more often than not, those procedures don't actually help in the long run.
They really don't. Studies are finding that people with BDD who get cosmetic surgery, most of them don't feel any less distressed about their appearance afterward.
So they get the surgery, but the BDD just finds something else to latch onto.
Often, yeah. It might be a different body part this time, or maybe they hyper-focus on something they don't like about the results. It's like the problem goes deeper than just the surface.
So what's the takeaway for someone with BDD who's thinking about cosmetic surgery? What should they do?
Talk to a therapist, first and foremost. And it's not about shutting down the idea entirely. It's more about making sure those underlying psychological factors are being addressed.
Because cosmetic surgery isn't a cure for BDD.
Definitely not. It's a big decision, and people need to go into it with eyes wide open, understanding the risks, the benefits, and most importantly, making sure it's not just the BDD calling the shots.
So instead of trying to change the outside, it's more about shifting that focus inward, learning to have a healthier relationship with your body and how you see yourself.
Now you're getting it.
Yeah.
And that's where some of those other therapies come in, like the mindfulness and acceptance-based stuff we touched on. Those are all about cultivating self-compassion and learning to accept your body as it is.
So instead of chasing after this perfect image that doesn't even exist, it's about saying, this is me, and that's okay, flaws and all.
Exactly. And that shift, it can be incredibly freeing.
This deep dive has been wild, seriously. We've gone from the history of BDD to how it develops all the way to treatment, and even the tricky stuff with cosmetic procedures. There's so much more to this than most people realize. Before we wrap up this part, though, there were a couple more things I wanted to hit from the research. BDD by proxy stuck out to me. What is that?
Yeah. BDD by proxy is definitely lesser known, but super important. So in this case, the person isn't focused on their own perceived flaws. Instead, they're fixated on a defect in someone else. Usually it's someone close, like a partner or family member.
Wow, so they're basically projecting their own body image issues onto this other person.
In a way, yeah. And they might constantly criticize that person's looks, push them to get procedures, even try to fix it themselves. You can imagine how tough that is for everyone involved.
Sounds incredibly damaging to
It
relationships.
can be really tough. Therapists need to have this on their radar because often the person with BDD by proxy is so focused on their loved one, their own struggles with body image might fly under the radar. It just goes to show BDD doesn't just affect the person with the diagnosis, the people around them, they feel it too.
Which actually leads perfectly into another point from the research.
Yeah.
How often BDD shows up alongside other mental health conditions.
Oh, absolutely. It's rare to see BDD all by itself. A lot of times it's part of a bigger picture: depression, anxiety, eating disorders, OCD, you name it.
So it's never as simple as just treating the BDD right. You have to look at the whole person.
100%. It's like a tangled up necklace. You can't just focus on one knot without seeing how it affects everything else.
This has been intense, but so insightful. I feel like I've learned a ton about BDD today.
It's a lot to take in, but the more we know about BDD, the better equipped we are to help, whether it's for ourselves or someone we care about.
And to anyone listening who might be struggling with this, please know you're not alone, okay? There is help out there, and recovery is possible. Treatment works. It really is. Knowing there are effective treatments out there, that's huge. Before we wrap up completely, though, there was one more thing from the research, a technique that really stuck with me. Imagery rescripting. Can you talk about that a bit more? Who's it for? How does it work? All that.
Yeah, imagery rescripting, it's powerful stuff, especially if you've got those really vivid, upsetting memories tied to your appearance, the kind of memories that just keep those negative beliefs about yourself alive.
So like someone who got bullied about their looks as a kid, those experiences can stick with you, even as an adult.
Exactly. They don't just go away because you want them to. But with imagery rescripting, you revisit them in a safe space with a therapist. But you're not just reliving the trauma, it's active.
You're actually changing how it played out.
Yeah. With the therapist guiding you, you change the memory. You get to create a new ending, one where you feel strong, supported, able to stand up for yourself.
That's got to be so healing, like you're finally getting the kindness and validation you deserved back then.
That's a great way to put it. It's about taking back your story. You're not stuck with that old, painful narrative anymore.
I love that. We've covered a ton of ground today, from what causes BDD to how it's treated, even the more complex stuff like cosmetic surgery and those historical cases. It's been pretty eye-opening.
It really has. But like we always say, the more you understand about something, the better equipped you are to deal with it.
Exactly. And for anyone out there listening who's maybe connecting with some of this, please hear this. You're not alone, okay? Treatment works, there's hope, and recovery is possible. We'll keep diving deep into these topics, but for today, that's a wrap. Thanks for being here, everyone.